I wanted to talk a little bit today about the research on mental health program, and specifically about the institutional level work group and the survey work group, which are being initiated there, to actually carry out what we hope will be the largest ever European-wide empirical survey study on mental health in academia. To give you a bit of background as to how I got into this topic, when I actually like a couple of years ago, I started thinking about mental health myself and that of my colleague, and I noticed that in academia we actually normalize our experience. Right? So when people ask me how I'm doing, I say I'm busy. And when my wife finds me at 3:30 in the morning working on an academic paper, I pretend that's normal. And so I think there's this tendency towards just sort of accepting that this is part and parcel of academia. Several years ago, I was also at a meeting of the future of work and organizational psychology movement in Breda in the Netherlands. And there was a session on mental health there. And at some point, it made a very lasting impression on me. At some point in this room of adults, about 4 people were crying, and people were recounting stories of burnout, of stress, of facing mental health issues in a vacuum, essentially. Ryan, could I ask you to please turn off your microphone? Thank you. There's many accounts of personal struggles in academia. I see colleagues around me suffering from burnouts and things like that. And fortunately, given the level of autonomy that we have as researchers, we're free to do something about this as well. And so that sort of motivated me to get into this topic. And we also indeed, even though many academic workplaces fail, during this very meeting of FOWOP, there were some researchers who said, I don't recognize this at all in my institution. I am cared for, and we do have a very healthy work environment. So those are some of the considerations that I had going into this type of research. And in the FOWOP movement, we actually grouped together and wrote a manifesto, and this manifesto basically talks about the future of work and organizational psychology. So here are a bunch of work and organizational psychologists who sort of realize that perhaps due to our background and the specific discipline in which we are embedded, perhaps we should have a voice as to how to improve workplace mental health. And in this manifesto, we make a number of recommendations that have to do with all aspects of the research enterprise, if you will, but some have a specific bearing on mental health. So we conclude in this manifesto that as researchers, as members of the academic community, we have responsibilities towards ourselves, so to keep ourselves healthy and sustainably employed and what have you not. We also have responsibilities as supervisors, something that Martin was talking about as well. So once we actually start supervising PhDs, in a way, we are also responsible for managing their mental health and ensuring that they get through this very difficult endeavor, because nobody ever said that a PhD was easy. Feeling supported and feeling like there's someone who cares about how they're doing. And furthermore, as academics, I think we also have greater responsibilities towards the participants in our research, towards our students, our community, and even society, if you will. So to bring you to what we're sort of thinking about in the ReMO project, basically ReMO stands for Research on Mental Health Observatory. Okay, so a good deal of the project is about collecting data and collecting evidence for those policies and interventions that might actually make a difference on the workflow. And we're at the institutional or in the institutional level work group, we're teaming up with this FOVOG movement that has a subgroup called Healthy Academic or Healthy Academia, I believe, to conduct a systematic review of the extant literature on the antecedents of mental health at work. So we're currently in the process of scouring a large number of databases for studies, and we're writing up this literature review, which we expect to submit at some point in the near future. Furthermore, in the ReMO project itself, we're also establishing an evidence hub where the different partners in the ReMO network can actually seek and find evidence for specific policies that they may or want to implement at their own institutions. Now, clearly, the research literature on research and mental health is still growing. There's some things we know, but there's also a lot we do not know. So as part of the ReMO project, as I was mentioning earlier, we're going to be launching a large-scale, multi-country, multi-level survey study on the antecedents of researcher mental health in an effort to identify specific policies that should be implemented if one is to ensure a healthy workforce. Now, what I mean with a multi-level study is that in order to evidence specific policies, what we may be able to do is to examine inter-institutional differences between the policies that have been implemented. So what we want to do in this survey is we want to ask researchers about their experiences at work. So is there a program in place in which you are helped to manage your time? What do you think of the supervision that you receive? And so forth. And across institutions then, we expect to be able to identify variants on these antecedents of mental health, if you will. So there are a few challenges there. So clearly, mental health itself is not a unidimensional construct. So we need to come up with measures for what we consider to constitute mental health. And I thought I'd kind of summarize this a little bit in a picture, but it was animated, but unfortunately the animations have dropped. But maybe I can quickly summarize some of the concerns that we have going into this multi-country study on research on mental health. So essentially, in the theoretical realm, we can talk about causes of mental health, right? So sleep deprivation or work overload or what have you not. A key question in sort of researching these antecedents of mental health, if you will, is to translate it to measures on which we can go and collect some data. So that is a question of construct validity. So we have to translate our measure of a specific policy to a measure that people in different countries at different institutions will be able to understand and will be able to answer to. And the same goes for mental health. So maybe in different languages, for instance, these different issues that people experience may have a different connotation or a different meaning. So we need to think carefully about how we word this on the survey. Once we have those measures, though, hopefully we can establish that they are related to one another across these institutions and countries. And maybe, but this might be a bridge too far, that they are causally related so that we can, in fact, identify which policies cause individual level mental health. And ultimately, a concern then is external validity. So the question of whether the findings that we report on the basis of this survey study will generalize to different institutions in Europe who may or may not have participated in this research, and perhaps also beyond, so to North America and so forth. So the survey work group has its kickoff event on the 15th of October, and we're looking forward on thinking about how to tackle these questions. Clearly, there's many other questions that need to be addressed here. We need to think about privacy of respondents who participate in this survey. We need to think about how to reach these people at the institutional level and so forth. So there's a lot of exciting work that lays ahead of us. But ultimately, we aim for this to be a study with tens of thousands of participants, in which we can really make some authoritative conclusions about the specific policies that make a difference. Great. I think that's all I had in store for you today. So thanks for your attention. And if there's any questions, I'll take those.